Hi everyone, my name is Kelsey Cable, and today I will be presenting my scholarly project titled Improving Compliance of Daily CHG Bathing for Patients with the Central Line. I am both very pleased and proud of this DNP project. I cannot wait to share more with you, so with that, let's get started. The committee on this project includes 3 people: my chair, Dr. Gail Petroff, the second reader, Dr. Snell, and my chosen community member, who is Sandra Seeley. For the background and significance, the aim of this project was to improve the compliance of daily chlorhexidine gluconate, also known as CHG, bathing. Central lines are a major infection risk to the patient. However, daily bathing with a CHG solution significantly reduces the risk of the patient developing a central line associated bloodstream infection, also known as eclampsia. This CHG solution is an antiseptic that prevents microorganisms from growing on the skin for up to 24 hours, which in return significantly reduces the risk of developing eclampsia. Although we as nurses know that daily bathing with a CHG solution is a part of an evidence-based central line associated bloodstream infection prevention bundle, the compliance of this intervention was very poor and needed improvement. Eclampsia is certainly something that we want to prevent for our patients, as it can result in increased morbidity, mortality, prolonged hospital stays, and increased healthcare costs. This project aimed to improve the compliance of daily CHG bathing by healthcare staff to reduce the risk and development of eclampsias. For the patterns of knowing, there are 5 different patterns of knowing, and this project addressed each individually. The first one is empirics. This project relates to this pattern of knowing by making changes to an observed problem, collecting data, and improving staff's infection control strategies to decrease eclampsias. The second pattern is personal. This project analyzed one aspect of why CHG bathing was not being completed daily for this patient population. This project looked to see if compliance was improved after placing a reminder on the nurse's work list to complete the CHG bath. Since compliance improved after this intervention, this means staff simply forgot to complete the CHG bath that day due to lack of reminders throughout their very busy day. The next pattern is aesthetic. As the actions and attitude toward daily CHG bathing improved, the staff members and patients can contribute to share mutual feelings of happiness, knowing that the patient's risk of developing eclampsia will reduce, and therefore the outcome will increase. The next pattern is ethical. There are many other tasks that a nurse needs to accomplish during their shift, but compliance to CHG bathing needs to be improved, as eclampsias can be detrimental to patients. Lastly, the final pattern of knowing is emancipatory. This project improved the status quo for staff. As compliance for daily CHG bathing increased, the new standard of providing care in the unit changed in a positive direction. Therefore, this increased patient outcomes by decreasing the risk of infection through that central line. The review of the literature. Although central lines are very, very useful in practice, they also carry the risk of life-threatening complications. Each year in the United States, eclampsias result in 28,000 deaths and roughly $2.3 billion in added costs. However, the majority of these infections were entirely preventable by following the infection prevention bundle and completing daily bathing with a CHG solution. So if we are aware of this amazing intervention, why is it not being completed daily? Nurses are a critical part of healthcare, however, staffing still remains to be an issue. As nurses continue to work short-staffed, time constraints continue to occur, and CHG bathing compliance remains poor. Due to these constraints resulting from being short-staffed, nurses may need to prioritize which interventions they are able to complete during their shift, which can result in daily CHG bathing for this patient population to not be completed every single day. The question becomes, are nurses simply forgetting to complete the daily CHG bathing because there are previously no reminders in the electronic health record to complete this task? And this study showed that as adherence to daily CHG bathing increased, also eclampsia rates significantly decreased. For the theoretical framework, throughout the research, the Plan, Do, Study, Act model, also known as the PDSA model, was consistently noted. The PDSA model is a four-stage problem-solving model that is used for improving a process or carrying out a change. This model is often used in healthcare settings because it provides structure for testing various changes to measure how they impact quality. The PDSA model was recommended as an effective approach for quality improvement projects and supported this project very well. So for each step plan, improving the compliance rate of daily CHG bathing for patients with the central line, that was always the goal. Compliance was measured by analyzing the electronic health record documentation for daily CHG baths. The plan was to add a prompt in the electronic medical record for staff to complete daily CHG bathing for this patient population, which I hoped in return would improve compliance rates. The next phase is Do. This phase included the actual change in the electronic health record to the work list for staff as a reminder to complete this daily CHG bathing for patients with the central line to reduce the risk and development of CLABSIs. The next section would be Study. This was where the CHG bathing compliance rate was analyzed again to see if there was a change in compliance rates. For this project, this was comparing pre-intervention compliance rates with post-intervention compliance rates. Lastly, the fourth phase is Act. This is where the quality improvement measure is reflected on to determine if the change was successful and can be implemented into practice long term. We will discuss this part of the model in the results section. Methods and design. A quantitative and exploratory design that incorporated a retrospective chart review was used for this project. With the help of the electronic health record, EPIC, and their report officers, I was able to generate a compliance report sheet for patients with the central line to see how often daily CHG bathing was truly being completed. This allowed me to compute past dates into the system and see what compliance rates were at that specific time. Because of this, I was able to begin my intervention of adding daily CHG bathing to the electronic health records work list and gather compliance rates before and after this program launched. Compliance rates were gathered 20 weeks prior to the start of the intervention and 20 weeks post-intervention. I chose this study design because it allowed me to compare the data before the intervention and afterwards. For the sample descriptive statistics, these were used to provide a description of data collected during quantitative research. Descriptive statistics were used to assess the central line types included for the patients in this study. The pre-intervention central line types consisted of 60.9% PIC double lumens, 9.5% PIC triple lumens, 1.1% Port A catheters, 3.4% CVC triples, 11.7% PIC singles, and 13.4% hemodialysis catheter. The post-intervention central line types consisted of 26% PIC double lumens, 3% PIC triple lumens, 13% Port A catheters, 1.3% CVC triples, 10.4% PIC singles, and 46.3% hemodialysis catheters. For the data analysis, an upper tail z-test for the difference of two proportions was used for this study. This test was selected because it could be used to determine the significance of the difference in that daily CHG bathing after CHG bathing was added to the electronic health record work list. And for the results, prior to the intervention, compliance of daily CHG bathing for this patient population was only 52%, so just a little bit over 50% of the time. After adding CHG bathing to the nurse and patient care technician's work list, who were caring for a patient with a central line automatically, compliance rates raised to 87.5%. This intervention showed a 35.5% increase in compliance rates. Patients with the central line who had daily bathing with CHG solution added to the EPIC work list had statistically significantly higher compliance rates than patients with the central line who did not have daily bathing with that CHG solution added to the EPIC work list. Z was equal to 7.9337 and P was less than 0.0001. Since adding daily CHG bathing to the work list in EPIC, there have been no CLABSIs reported at the project site. And of course, every study comes with some limitations which may have affected the results. Adding daily CHG bathing to the EPIC work list for both nurses and patient care techs showed a clear increase in compliance, but it is important to consider that other factors may have influenced the results. One factor may be the Hawthorne effect. This is when an individual has a change in behavior because they are aware that they are being observed. The staff at the research site may have increased their compliance with daily CHG bathing simply because they were aware that data was being collected on their compliance. Unfortunately, this may have increased compliance rates after the intervention was implemented. Another limitation includes reporting bias. This is when because data collection relied entirely on nurses and patient care technicians documenting that the daily CHG bathing was done. It is possible that staff marked the daily CHG bathing as completed in that EPIC work list without ever truly completing the CHG bath. The discussion: improving the compliance of daily CHG bathing for patients with the central line reduces the risk in development of CLABSIs by increasing the adherence to the evidence-based central line infection prevention bundle guideline. As compliance increases, CLABSI rates will decrease, along with morbidity, mortality, prolonged hospital stays, and increased healthcare costs. Lastly, patient safety and outcomes are also improved. For the implications of practice, the CDC and the Joint Commission consider daily CHG bathing for patients with the central line in place part of a standard of care for this patient population to reduce the infection rate of CLABSIs. By improving daily CHG bathing compliance through the electronic health record, improvements can be accomplished hospital-wide, which helps these hospitals hit their quality benchmarks. CLABSI rates are publicly reported and connected to the hospital reimbursement system through the Centers for Medicare and Medicaid Services Hospital-Acquired Condition Reduction Program. The findings from this project help the project site avoid financial penalties and improve the compliance of a proven intervention to prevent CLABSIs. The results from this study may also impact how nursing informatics and the electronic health record can improve the quality of care that is given to patients. The automatic prompts for the evidence-based practices would increase compliance by eliminating differences in staff knowledge and poor communication amongst staff members. So not only is this intervention impacting the patients in a very positive way, but the organization is also benefiting from improved compliance rates. This intervention also benefits the patients, as we said, and as discussed, improved compliance rates of the daily CHG bathing for patients with the central line will decrease morbidity, mortality, healthcare costs, and prolonged hospitalizations. This DMP project met all of the DMP essentials, so quickly reviewing these. The knowledge for nursing practice. This project used daily CHG bathing, which, as we know, is an evidence-based infection prevention method, along with altering the EPIC work list to create a positive impact. By combining the EPIC health system, nursing, and informatics, the daily CHG bathing compliance improved. In return, this improves patient safety and outcomes. Person-centered care. By improving daily CHG bathing compliance for patients with the central line, individualized and person-centered care is provided by reducing the risk of preventable infection diseases. This project increased the compliance of patients receiving evidence-based care that protects their health. For population health, this project focused on a very high-risk population. As we discussed earlier, having a central line in place can be very risky. Patients who have a central line are at risk for eclampsies, prolonged hospitalizations, increased healthcare costs, morbidity, and mortality. This intervention contributes towards health equity and safety, and expanding this project hospital or even network-wide could reduce these infection rates. The Scholarship for Nursing Discipline, this DNP project was a quality improvement project that evaluated the intervention's effect on compliance rates. The project increased the compliance rates of an evidence-based intervention at preventing eclampsies. The data collection, analysis, and results support future research on this subject. For quality and safety, the main idea of this project was quality improvement and patient safety. This project targeted poor compliance rates of daily CHG bathing, which is the main cause of eclampsies. This reduced a preventable infection and increased quality of care and patient safety. The next DNP essential is the interprofessional partnerships. When creating this project, there was a collaboration with other nurses, patient care technicians, managers, council members, infection prevention team members, and the chief nursing officer to design and implement this project. There was interdisciplinary collaboration to increase patient outcomes by coming up with the best project design to give the best results possible. Systems-based practice by adding daily CHG bathing into the electronic health record worklist. This addressed system-level gaps in workflow and reduced variability and human error. This project did more than just educate staff on the importance of daily CHG bathing. It approached the problem at the system level to make improvements. Informatics and healthcare technology. The Epic electronic health record used the worklist to automatically populate tasks for staff to complete and track their compliance rates throughout the project. This showed how nursing informatics can be used to promote change and provide high-quality care. Professionalism, this project focused on that patient safety gap that could be improved and developed a practical solution. By attempting to improve a noted patient safety gap, this allows the professional accountability, ethical responsibility, and advocacy of all nurses, including the researcher, should have the right to protect those patients. Lastly, the personal, professional, and leadership development. This project allowed the researcher to become a clinical leader. Through research and professional communication and project execution, the researcher was able to create a meaningful change and have an impact on patients. So in conclusion, adding that daily CHG bathing as a task to the work list automatically for both nurses and patient care technicians significantly improved compliance rates. I mean, there was a 35.5% increase in those compliance rates, which is statistically significant. This research was impactful because it was beneficial for both the patients because they have better outcomes and the organization because they have better compliance rates, which means that they get better reimbursed. After completing this research project, I thought about it a little bit, and if I could do anything different with this research project, I would have someone on the research site confirming that these daily CHG baths that the nurses and patient care technicians were charting were truly being done each and every single day. Unfortunately, all of my data is based on what those healthcare staff charted, that reporting bias. So by having someone there, even the charge nurse that is there and laying eyes and signing off on every single one of these CHG baths, this could help limit my reporting bias and ensure that my data is truly accurate. In the future, I hope to have this intervention implemented hospital-wide and not just at the research site. And then after going hospital-wide, I hope that it could go to the entire organization. I truly think that my research will have a positive impact. And throughout this entire program, this DNP program has challenged me in more ways than one, that's for sure. I learned the ins and outs of research and how lengthy the process truly is to complete a research project. This program has opened so many doors for me, and I can't wait to see what the future holds. I want to say thank you to every instructor and faculty member that has guided me along the way. And lastly, these are my references. And thank you so much for listening. Have a great day.